Hi, my name is Elena, and today we're going to be talking about pulmonary function testing, also known as PFTs. Our learning objectives are for number one is what is a PFT, populations that benefit from PFTs, main components of a PFT. Our second is interpretations of FVC, FEV1, and FEV1%, identifying restrictive and obstructive diseases, and then what determines severity. For number three, it's quality control, volume calibration requirement, quality control tests for leaks, volumes, linearity, flow linearity, and time. And then lastly, for number four, it's going to be infection control, how PFT equipment is disinfected, disposable single patient use equipment, and airborne isolation precautions for PFTs. So, firstly, what is a PFT? So, PFT stands for pulmonary function test. It is a non invasive diagnostic test that measures how well your lungs take in and release oxygen or air, along with how effectively they transfer oxygen into the blood. These tests are used to diagnose lung conditions like asthma, COPD, and monitoring disease progression and evaluating lung function before surgery. Populations that benefit from PFT. So it would benefit individuals with respiratory symptoms, those experiencing short of breath, especially during exercise, a persistent cough, wheezing, or pain in your chest. COPD patients are a big population for PFTs. These are used to diagnose staging and tracking progression, particularly in smokers or individuals over 55 with significant smoking history. Asthma patients use essentially for diagnosis and determining the severity, along with checking how well treatments are working. Older adults, as we get older in our ages, around 60 years old or so, lung function deteriorates just like a lot of our bodily functions. Preoperative patients, patients that have a heart lung problem, or and that are undergoing anesthesia need a PFT before surgery just to determine their baseline, and to determine if the surgery caused any damage or setbacks to their heart and their lungs. Occupational exposure risks. Patients exposed to industrial dust, chemicals, or vapors, as well as firefighters, need PFT monitoring just to make sure that their lungs are functioning properly. Other lung conditions, other individuals with suspected restricted lung function, such as pulmonary fibrosis or thoracic muscle weakness. Okay, so the main components of a PFT are spirometry. These measures the amount, in a sense, the volume and the speed, which is the flow of air that can be inhaled and exhaled. Key measurements include FVC, which stands for forced vital capacity, and FEV1, forced expiratory volume in 1 second. So that is the amount of air that you can push out of your lungs in 1 second. Lung volumes measures total air in lungs, including residual volume, and that is the air that is left after you have blown out all the air that you can in your lungs. And then TLC, which stands for total lung capacity. The diffusion capacity, which is also referred to as a DLCO, evaluates how effectively oxygen and carbon dioxide from the lungs transfer from lungs to the blood. Bronchodilator reversibility. This is mostly used for asthma patients, often added to the spirometry to see if airflow improves with medication, just to make sure that the asthma patients are able to um, effectively use their medication and the medication effectively reverse their symptoms to keep it out of control. And they're able to maintain a normal day to day life. Cardiopulmonary exercise tests, CPET. These evaluates the heart, lung, and muscle performance during activity. So in this picture here, we have a patient in a body box, is what we call it, and she is doing spirometry. So like the thing right here that she is blowing in, it'll measure her lung capacity depending on the tests. And then we provide a nose clip just to make sure that there's a complete seal and there's no air coming out. And then the computer system measures your lungs and airflow, and then the RT will instruct the patient to do certain types of breathings depending on the test that they're performing.